Plastic surgery is not as taboo as it was in days gone by. If you can afford a surgeon's masterful touch, the reasoning goes, why not be the best you can be?
Yeah, but even the shape of your face has changed.
No, it has not. I've had no plastic surgery on my face, just my nose.
In a world where fame often hinges on appearance, many celebrities turn to plastic surgery for perfection, but not without risk. Though cosmetic procedures are generally safe and have a long history, the price of a misstep can be devastating. Even the most glamorous stars can fall victim to the harsh realities of plastic surgery gone wrong. The transformations are stark reminders that not all that glitters is gold. While wealth often opens the doors to endless possibilities, including physical transformation, the question arises, should there be limits to this unrestrained pursuit of beauty? Join us as we delve into how celebrity plastic surgery disasters reveal the dangers. Mickey Rourke's plastic surgery journey. Mickey Rourke's plastic surgery journey is quite different from many other celebrities who seek facial rejuvenation to combat aging. His decision was driven not by vanity, but by necessity after sustaining severe facial injuries during his boxing career in the 1990s. Rourke, a seasoned actor, transitioned into professional boxing, a sport he had been passionate about since childhood. As an amateur boxer, he achieved great success, boasting an impressive record of 12 consecutive knockouts during the 1960s and 1970s. When he turned professional, Rourke remained undefeated in 8 fights, securing 6 wins, 4 by knockout and 2 draws. However, the physical toll on his face was immense. He endured 2 broken noses, a split tongue, a compressed cheekbone, and even short-term memory loss. To repair the damage, Rourke underwent multiple reconstructive surgeries, hoping to restore his facial features. Unfortunately, the results left him dissatisfied, leading to subsequent procedures. Today, Rourke is nearly unrecognizable compared to his earlier years. In total, Rourke had 5 nose operations and 1 to repair his damaged cheekbone. Most of these surgeries aimed to fix the injuries from his boxing career. However, Rourke later admitted that choosing the wrong surgeon played a role in his disappointment with the outcome, leaving him with a face that no longer resembled the man we once knew on screen. Anastasia Polishchuk's controversial journey into cosmetic enhancements. Anastasia Polishchuk, originally from Kyiv, Ukraine, has undergone various cosmetic procedures, including Botox, veneers, chin and jaw reshaping, and liposuction. While these may sound like routine enhancements, the real astonishment comes when you see the results of her transformation. Anastasia started experimenting with cosmetic surgery at just 26, embarking on an unconventional path that would set her apart in the beauty world. What makes her story particularly unique is her decision to take matters into her own hands. Relying on online tutorials, Anastasia began administering her filler injections, confidently asserting that she followed strict sterilization procedures. With a conviction typically reserved for professionals, she injects herself, believing wholeheartedly in her abilities to perform what is normally a medical procedure. Katie Price's plastic surgery journey. Katie Price, the English media personality and model, stands out in the celebrity world for her candidness about her plastic surgery journey. Price openly acknowledges her numerous cosmetic procedures and has been vocal about her extensive transformations, unlike many of her peers. Throughout her modeling career, Katie Price initially maintained a natural appearance. However, it wasn't until she reached 30 that she began to make notable changes. Now, at 45, she is unapologetic about her decisions and continues to pursue her desired look without hesitation. Her transformation journey began in 1999 when she significantly enhanced her bust, increasing her size from 32B to 32DD and refining the shape of her nose. By 2006, Price had embraced a more altered look, and by 2011, she proudly declared herself as totally plastic. Price's cosmetic enhancements became increasingly dramatic over time. In 2016, she opted for fuller lips and a smoother, shinier complexion. 2 years later, her appearance at the National Television Awards was so strikingly different that she became almost unrecognizable. Her surgeries escalated further, including annual breast augmentations starting in 2019. Each of her breast implants is estimated to weigh about 4.4 pounds, raising concerns among plastic surgeons about her overall health. Dr. Sko Felix, a plastic surgeon, has expressed concern about the frequency and extent of Price's surgeries, emphasizing that it could cause worry. Heidi Montag's several surgical procedures. Heidi Montag, best known for her role on Laguna Beach, learned a profound lesson about the complexities of cosmetic surgery. Her journey into extensive plastic surgery began with an enticing offer of complementary enhancements, promising thousands of dollars worth of procedures at no cost. However, the reality of the experience was far from her expectations. Montag's transformation involved an arduous 16-hour surgery in which she underwent a total of 10 procedures in a single day. The extensive operation, combined with an excessive amount of opioid pain medication, left her feeling fragile and frail during an extended recovery period. At just 23 years old, she had already undergone several procedures, including a brow lift, chin reduction, and Botox injections. Looking back, Montag regrets many of her decisions. She has come to realize that she never truly needed these surgeries and now advises those considering plastic surgery to consult with both professionals and loved ones. She emphasizes the importance of understanding the root causes of insecurities before proceeding with any cosmetic changes. While Montag does not oppose plastic surgery, she aims to shed light on the less glamorous aspects of body alteration. She stresses that people often see only the polished before and after photos, missing out on the challenges and hardships that can occur during recovery. Donatella Versace's cosmetic enhancement story. Donatella Versace, the Italian fashion designer and sister of Gianni Versace, is another high-profile figure whose cosmetic enhancements have sparked interest and speculation. Although the exact extent of Versace's procedures is not publicly confirmed, visible signs suggest she has undergone significant cosmetic work. At nearly 70, her remarkably smooth and wrinkle-free face is unusual for someone her age. Indicators of potential enhancements include a more slender and pointed nose, less droopy upper eyelids, fuller cheeks, and altered lips, which may be due to cheek implants and lip augmentation. In 2014, Versace was photographed with an exceptionally shiny appearance, which clinical director Mark Norfolk attributed to extensive Botox use. Norfolk explained that Botox can create a stretched, shiny, and line-free forehead, which aligns with Versace's look. He also noted that it's uncommon for a woman her age to have no forehead lines or wrinkles, and her eyes appeared somewhat half-shut, further suggesting possible Botox use. Given these observations, it is reasonable to assume that Donatella Versace may have utilized Botox or other cosmetic treatments to maintain her youthful appearance. Neven Sanović's unusual and troubling side effects from surgery. Neven Sanović, a 45-year-old Croatian celebrity stylist and reality TV personality, is well known for his significant contributions to Croatian reality television and his extensive history of cosmetic surgeries. Recently, Sanović disclosed an unusual and troubling side effect from his latest surgery: a persistent erection. Sanović had opted for his third nasal operation at a clinic in Iran, primarily due to cost considerations. However, he was forced to return to Belgrade abruptly due to a rare condition known as priapism. This condition, caused by an allergic reaction to the anesthetic, necessitates immediate medical attention to prevent severe complications and irreversible erectile dysfunction, as highlighted by the French Association of Urology. Michael Jackson's dramatic transformation. Michael Jackson's dramatic transformation is closely associated with his extensive use of plastic surgery. A comparison of photographs from his youth to the final images taken before his death in 2009 reveals a profound alteration in his appearance. According to sources like the Daily Mail, Jackson underwent numerous procedures, some of which were intended to correct previous surgeries that had gone awry. Jackson's journey with cosmetic surgery began with his desire to refine his nose. Reports suggest that he was so apprehensive about his initial rhinoplasty that he asked his sister LaToya to undergo the procedure first as a test. Once satisfied with the outcome, he proceeded with his surgery in 1979. marking the start of his transformative journey. Dr. E.A. Gorbis, an expert in body dysmorphic disorder, speculates that Jackson may have undergone as many as 100 surgeries. Some of these procedures significantly altered his features, making his ethnicity difficult to discern. Although the precise number and nature of these surgeries remain uncertain, Dr. Wallace Goodstein, who worked with Jackson's surgeons in the 1990s, revealed that they included multiple nose jobs, cheek implants, eyelid surgery, and the insertion of a chin implant. Dr. Goodstein disclosed that Jackson would visit for surgeries every 2 months, sometimes undergoing as many as a dozen procedures during each visit. Jessica Alves' numerous cosmetic operations. Jessica Alves, formerly Rodrigo Alves, is a Brazilian-British television personality renowned for her numerous cosmetic surgeries. Born in São Paulo, Brazil, on July 30, 1983, Alves was raised by a Brazilian mother and a British father. Her father's family had a history of European immigration to Brazil in the 1940s and was initially involved in agriculture before moving into supermarkets, shopping malls, and real estate. From a young age, Alves expressed her gender identity through play and cross-dressing, despite being born male. She firmly believes that gender should not be used to categorize individuals. During adolescence, Alves experienced a hormone imbalance with excessive estrogen, leading to the development of breast tissue. She also faced bullying due to her unique characteristics. Over the years, Jessica Alves has undergone many cosmetic operations. Her transformation has involved more than 103 procedures, 51 of which were plastic surgeries as of 2018. These surgeries, including multiple nose procedures that resulted in the loss of her sense of smell, have cost just over £500,000. Raji Narine Singh is a multi-talented American figure known for her work as an actress, LGBTQ+ advocate, writer, singer, and reality TV star. Her story gained widespread attention after she appeared on Botched, a show on E! Entertainment, where she revealed her struggle to remove cement-like substances injected into her face, breasts, and hips. These catastrophic complications arose from an encounter with an unlicensed practitioner who administered dangerous, unregulated filler injections. Born into a richly diverse family, Raji hails from the Dogla ethnic group, with roots spanning Indo-Trinidadian, French-African Trinidadian, and Polynesian heritage. In the late 1990s, she embraced her identity as a transgender woman. She began her transition, a profound and empowering journey that shaped her life. However, in 2005, Raji's pursuit of feminine features led her to a dangerous decision. She sought out O'Neill Ron Morris, infamously known as the Duchess, in Miami's transgender community, who offered low-cost alternatives to professional cosmetic surgery. Raji thought silicone was a lethal cocktail of concrete, tire sealant, mineral oil, and glue. For months, she was unaware of the true nature of the substances injected into her body. Still, soon her face and body reacted severely, swelling and developing nodules where the dangerous fillers had been placed. For years, Raji was so devastated by her appearance that she withdrew from public life, isolated herself, and avoided treatment. Her courageous story, documented on Botched, shows her determination to reclaim her life. After a second appearance on the show, surgeons successfully removed a significant portion of the harmful material, giving Raji a chance to move forward. Hang Myoku's tragic tale of obsession and self-destruction. Hang Myoku's story serves as a stark cautionary tale about the dangers of addictive behavior, particularly when it comes to plastic surgery. Once a successful model and singer, Hang's quest for physical perfection began at 28, driven by a desire for flawless skin. She even relocated to Japan to undergo a series of cosmetic procedures. But her relentless pursuit of perfection soon spiraled out of control. As the surgeries became more frequent, doctors grew concerned and began refusing to perform further operations. Undeterred, Hang returned to Korea, her appearance now so altered that her own parents struggled to recognize her. Though she initially sought psychiatric help for her growing obsession, she eventually stopped attending her sessions. She resumed her search for a plastic surgeon willing to continue her treatments. This is one of the unpopular dangers of plastic surgery, the addiction to the pursuit of perfection. However, Hang eventually found a doctor who provided her with silicone injections and the supplies necessary for self-administration. However, when her resources ran out, desperation led her down a dangerous path, injecting cooking oil into her face. The results were catastrophic. Her face became severely swollen, scarred, and disfigured beyond recognition. Her tragic story sparked widespread public sympathy, and donations poured in to help her restore her appearance. Hang underwent 10 surgeries to remove the substances from her face, but only some of the damage could be undone. The size of her face was reduced, but the scars of her addiction remained. Cardi B's cosmetic surgery experiences. In contrast, American rapper Cardi B is equally open about her cosmetic surgery experiences, but offers caution. Known for her bold personality and music that resonates with audiences of all ages, Cardi B has always been vocal about her procedures, including some she now regrets. During a candid Instagram live session, she revealed that she recently underwent surgery to remove her butt implants, which were 95% biopolymer, in August. She recounted the challenges of the procedure and issued a strong warning to her followers. Never opt for biopolymer injections. Cardi B shared that she initially got the implants during her time as a stripper, paying only $800 to have them done by an unlicensed individual in a basement. The procedure posed serious risks, as the filler can migrate through the body. The person who had performed her procedure was reportedly linked to a tragic case in which a woman died due to the same injections. While Cardi B is critical of biopolymers, she is not against plastic surgery altogether. She has openly admitted to having a nose job, stating that she disliked her father's nose and chose to change it. Cardi B's message is clear. If you're unhappy with an aspect of yourself, it's okay to make changes, but always prioritize safety above all else. Things may often go wrong, and a life is lost on the operating table. However, when the tip of a newly sculpted nose turns black from necrosis and falls off, and when patients are left with debilitating pain, paralysis, or permanent disfigurement, the consequences are heartbreaking. Yet, beyond these catastrophic outcomes lies another question. Beauty is subjective, but when does personal preference cross the line into something truly tragic? Share your thoughts in the comment section below. Also, like our video, subscribe to the channel, and check out another of our interesting videos. See you on the other side.